Right, today we are starting with the lecture on brain stem, right? And you know brain stem has basically three parts: midbrain, pons and medulla, right? So if we view the brain stem from the side, it's like this. This is the midbrain, here is the pons, here is medulla, and of course this is connected down inferiorly with the, yes please, spinal cord. Is that right? And posteriorly it is having cerebellum, right? And at the top of the midbrain, of course, there is diencephalon and eventually cerebral hemisphere, right? Now, this part of brain stem is called, yes please, midbrain. Or other name for this is, yes please, mesencephalon, right? And this part of the brain stem, this is called pons, right? This is anterior side, of course, and here it is posterior, right? Okay. And what is this? Medulla. Actually, these series of lectures which we are starting, we are going to discuss first medulla in detail, then we will discuss the pons in detail, and then we will discuss midbrain, right? Now, before really I go into detail of what are the structures present in medulla and different sections, how you will see the structure, that is really a tough torture to the central nervous system. Understanding and memorizing that without having the comprehension. Because in USMLA there are many questions related with the lesions in the brain stem and structures in the brain stem. But if you try to memorize the sections and structures without having understanding, that is one of the very sophisticated type of mental torture, right? So we will not go through that torture. We refuse. What we do, that first we make the basic principles, very, very basic principles related with the brain stem, which are followed by the all three parts, right? And then we will talk about the structures in that. First of all, I will tell you that what are the different cranial nerves, because brain stem houses lot of cranial nerves nuclei. You know, first and second cranial nerves, which are olfactory and optic, they are not related with the brain stem directly. But third cranial nerve up to 12th cranial nerve, the nuclei are present in the brain stem, their interconnections are related in the brain stem, right? So when we are talking about the brain stem, right, we have to have a very clear concept that which cranial nerves is attached with which part of the brain stem. Is that right? For this purpose, I will draw one view from the front also, right? This is the side view of the brain stem. We will consider the front view of the brain stem as well. Yeah, what is this from the front? This is midbrain from the front, and what is it? Pons, and what is it here? Medulla, and of course here it is your spinal cord, right? In the frontal view, this is ponto-medullary sulcus. What is it? In the frontal view, this is ponto-medullary sulcus, and this structure, these are midbrain cerebral cerebral peduncles. What are these structures? This rope-like structure which is moved, and this rope-like structure, right? These are what? Yes, please. Cerebral peduncle. What is your concept of peduncle? Peduncle is a very big bundle of fibers, white matter, right? Which is connecting brain stem with the cerebral hemisphere or with the cerebellum. Is that right? Now, what really happens when we talk about the peduncle, that the top is cerebral hemisphere. Is that right? So, cerebral peduncles connect the brain stem with the forebrain. And on the side, what is this here? Cerebellum. In the same way, there are connections with the cerebellum from the brain stem, and they are through these, what is this? Inferior cerebral peduncle. Here it is middle cerebral peduncle. This is functionally drawn diagram, not anatomically. And this is superior cerebral peduncle. Now what are these cerebral peduncles? These are bundles of white matter which are connecting the brain stem with the cerebellum. Is that right? And superior, which connect the midbrain with the cerebellum, superior cerebral peduncle. Middle cerebral peduncle connect the pons with the cerebellum. Inferior cerebral peduncle connect the medulla with the cerebellum. In that diagram, it can be shown like this. What is this? Superior cerebral peduncle. What is here? Middle cerebral peduncle. And what is this? Inferior cerebral peduncle. Am I clear? This view is very clear that there is brain stem. Inferiorly it is connected with the spinal cord. Above the brain stem it is connected with the forebrain. Is that right? Posteriorly it is connected with the cerebellum. Superior connections are especially white matter. These frontal structure which is seen, this is cerebral peduncles, and these side white matter bundles are cerebral peduncles. Is that right? Any question up to this? Then we see how the cranial nerves are attached to the brainstem structures. Now I will go for that. That exactly where on the brainstem cranial nerves are attached, right? So that we will later on understand their nuclei most probably should be in which part of the brainstem. Again, we'll make a side view of the brainstem. Now a bigger diagram. Is that right? And from here also we can make What is this? Yes, please. Midbrain. Here it is. Pons, and here it is medulla. What is this junction? Ponto-cerebellar junction, right? Now we have to attach the different cranial nerves there. Brainstem associated nerves are from 3 to 12. Is that right? We start from the top. First of all, on the back of the midbrain, there are two swellings. There are two swellings. What are these swellings called? Superior colliculus and inferior colliculus. You must be remembering that superior colliculus is concerned with visual reflexes and inferior colliculus is concerned with? That's good. Now, first of all, we'll start with the third cranial nerve. Third cranial nerve is, its nucleus is at the level of, what is this? Okay, I will not talk about nucleus. I will just talk about the exit point. About the nuclei we will talk later. Just right now we'll talk from which points the third cranial nerve exit. Third cranial nerve exit from the anterior part of the midbrain at the level of superior colliculus. Right, so this is the nerve which is coming out, and what is this nerve? Yes, please. Third cranial nerve. And what is the name of this nerve? Yes, oculomotor nerve. Right? Now, the fourth cranial nerve. Fourth cranial nerve is the only cranial nerve which emerges from the back of the central nervous system. Fourth cranial nerve is the only cranial nerve, rather out of all the nerves, this is the only nerve. No spinal nerves come out from the back, no cranial nerve comes out from the back except the fourth cranial nerve, and it emerges from the back of the midbrain at the level of inferior colliculus, and then it moves on the side of the midbrain and eventually moves forward. Fourth cranial nerve, and what is the name of this nerve? This is trochlear nerve. Trochlear nerve. Right, we'll have a full series of lectures on cranial nerves. Right, for a while you just trust me. The third and fourth cranial nerves are attached with midbrain. Third is at upper level, of course, and fourth is lower level. Third is coming from the front of the midbrain, and Fourth is exiting from the back of the midbrain. What do you think? Why this nerve is first? Because its nucleus is inside. First it goes backward and then it exits. But third cranial nerve has a nucleus here. It moves directly forward. Why this goes backward? Maybe forget the pathway or what? I will be really impressed if someone can tell me that why fourth cranial nerves, the pair of fourth cranial nerves within the midbrain, its fibers move backward and then exit from the back. And then it's a bit unusual, rather very unusual, because no other nerve behaves like that. I'm about to be impressed by someone. Remember, lateral movement is by the sixth nerve. It means you don't know what is the function of sixth nerve. That is abducent nerve for abduction of the eye. Yeah, there's no need to name abducent abduction of the eye. Yes.
There's a river aqueduct in the middle.
Okay, he thinks because there is cerebral aqueduct in the middle, so that does not allow it to move forward. This is not true, because nucleus is on the sides of the cerebral aqueduct, to be very precise, in the brainstem, not on the back of the cerebral aqueduct. Yes. Okay, you know there is something called pineal gland,
Yes.
right? And should I draw exactly where is the pineal gland? There is third ventricle here, and pineal gland is here on the back. And still pineal gland is, it was the most primitive rudimentary eye. Pineal gland was the most primitive rudimentary eye. Probably these nerves were concerned with that. Later on, this lost its function. It is buried within, as brain developed, pineal gland is buried within the central nervous system. It has lost direct any muscles for movement. Is that right? So trochlear nerve has gone with the eyeballs to supply the superior oblique muscles, right? So basically pineal gland is still concerned with some relationship, primitive relationship with the vision. Still visual pathway gives some fibers to the pineal gland. You will be surprised to know the visual pathway from chiasma gives from the chiasma some fibers to hypothalamus, and from the hypothalamus fiber are coming here. It means pineal gland is all the time knowing something about the visual system. Actually, pineal gland has all the record of your total daylight exposure and darkness, and according to that it releases melatonin. Have you heard of melatonin? And it maintains your circadian rhythms. We will not go into detail right now, but this is just to tell you why it comes from the back. Its friend has gone away, so it turns again forward after the eyeballs. Is that right? Anyway, let's come back. Third and fourth. Now, we connect the third and fourth from the frontal view. In the front, where you really see third coming out. This is cerebral peduncles. And this depression in between the two cerebral peduncles is called, yes, this depression in between the cerebral peduncles, this is called interpeduncular fossa. Right? And when it is full of CSF, we call it interpeduncular cistern. But, right, so this interpeduncular area, and of course, this side is the medial side of the, cerebral peduncles. Actually, third nerve emerges from here. Is it right? Actually, nuclei are somewhere here, and from here, fibers are moving within the brainstem and eventually exit from this area. Am I really clear to you? Now you know exactly where the third nerve is attached with the brain stem, right? It is attached with the midbrain in the front, right, on the medial side of interpeduncular. You can say on the medial side of cerebral peduncle, right? And it is emerging from there and moves anteriorly. Is that right? Fourth nerve, of course. Fourth nerve from the front, you cannot see it exact, but you can see that it is coming from the back forward. Is that right? Fourth nerve and fourth nerve. But basically, it is coming from the back. And and their nuclei are inferior to this. Is that right? So these are third and fourth nerve from the front, and here I show it from the back. After that, we come to the fifth nerve. Is that right? Fifth nerve is coming from pons. Fifth nerve is coming from pons. Now, this was Ponto-cerebellar junction or sulcus. Now, from mid-pontine, from lateral side, from mid-pontine, from the lateral side, this is the, what is coming out? Fifth nerve. It's a very large nerve, and right, we call it trigeminal nerve. You know, it comes to the ganglion and then gives 3 divisions. Do you know that? There is maxillary division, and there is, there is, it should be ophthalmic division, there is maxillary division, and there is mandibular division, right? So this is which nerve? Fifth cranial nerve, or we also call it trigeminal nerve. Trigeminal. Why we call it trigeminal nerve? Because at 3 gemini, gemini means root. It has ophthalmic root, it has maxillary, it has 3 divisions. So it has tri-part. So we call it trigeminal nerve. Actually, these fibers which are going, these are the sensory fibers related with the fifth cranial nerve, right? And here with it, there's the this is sensory root. Here the motor root of fifth also, right? And it also exits with that, and eventually it goes with the mandibular division. You may be knowing this fifth nerve motor component is concerned with which muscles? Muscles of mastication. Muscles of mastication. Right? So we know now 5 cranial nerves. Is that right? 5 cranial nerves. After that, we have to go to the, fifth cranial nerve we see on the lateral side also. In the frontal view, fifth cranial nerve, anterolateral area, it will come like this. Right? This is fifth cranial nerve rootlets. It has fifth cranial nerve rootlets, and these fifth cranial nerve rootlets, these are sensory or motor? Sensory. And with that, what are these fibers coming? Fifth cranial nerve motor fibers coming, right? Clear? So if someone asks where the fifth cranial nerve is attached to the brainstem, you will say with the pons anterolateral area. It exits out, right? Why it is so important to know these structure? Because if midbrain is damaged in upper part, third nerve will be involved. If midbrain is damaged in the lower part, fourth cranial nerve should be suffering. If pons into anterolateral area is suffering, you know which nerve will be involved, or other way around. If you know fifth nerve is involved and there is damage to the central nervous system, it must be a mid-pontine damage. But if you say the damage is to the brainstem, right, there is some tumor or there is some cancer or there is some infarction, there is damage to the brain, midbrain, and if I say fourth nerve is suffering, right, it means lower midbrain. But if I say there is third nerve suffering, then it is upper midbrain. So basically, exact position where these nerves are connected with the central nervous system, it helps us to localize the lesions related with the brainstem. That is the purpose to know. Now after that, which nerve should come? Sixth nerve. But before that, I would like to draw the different landmarks on medulla. This is pyramid. Is that right? And this is olive. And what is going on here? Inferior cerebellar peduncle. Inferior cerebellar peduncle. Now, after the fifth cranial nerve, which cranial nerves we have to discuss? Sixth, seventh, and eighth. Ventura will tell us that where the 6th, 7th and 8th are attached. You have any idea on the brainstem exactly? Very good, between the pons and medulla. It's very easy to understand. From medial to lateral, here is the nerve which exits, which is 6th, right? 6th, and from here the nerve which come out, what is that? 7th, and 6th nerve is which one? Abducent, which abduct the eyes. This is abducent, and what is this? 7th. 7th is facial, and then what is this nerve at ponto-medullary junction coming out? Yeah, this is 8th. So what we really see that at ponto-medullary sulcus, from medial to lateral, there is successive exit of 6th nerve, then more lateral 7th nerve, more lateral 8th nerve. Now what is the importance of this? Later on we will learn that if there are in the pons, lower pons, if there is damage in the most medial area, 6th nerve will be affected. Posteriorly, 6th nerve nucleus has 7th nerve fibers curving around it. So what really happens, that in very intimate relationship within the brainstem, if there is damage, 6th and 7th nerve become dysfunctional. But as 7th nerve come out, it eventually follows with the 8th nerve. It goes along with the 8th nerve. So if combination of 7th and 8th is affected, it means there is some tumor or some problem at the junction of pons and medulla, but on the lateral side. Am I clear? If 6th and 7th suffer, there is problem at pons and medulla, but on the medial side. But if 7th and 8th suffer, it means there is lesion on ponto-medullary junction, ponto-cerebellar junction, some people call it, because cerebellum is here, right? And right at the ponto-cerebellar junction, there is a lesion which may involve 7th and 8th nerve together. Is that right? Now let's put these nerves in relationship to the lateral diagram. Of course, you can understand from here which nerve is coming out from here. Yeah, 6th nerve, right? And from here, which nerve is coming out from here? Is 7th. And from here, which nerve system is coming out? 8. Is there any problem up to this? What is the name of the 6th? Abducent nerve. Right? What is this 7th? Facial nerve. And what is 8th? Yes, please. What is the name of the 8th cranial nerve? Yes, vestibulo. Concerned with the balance and hearing. Vestibular part concerned with the balance. Vestibulo, cochlear nerve. Cochlear nerve. Is that right? Vestibulo, cochlear nerve, right? You know up to how many nerves now exactly attached to the brainstem, from 3rd to 8th. Now we come other nerves. Of course, you know there are pyramids here and olives on the side. And if we see this diagram, now what is the structure here? Pyramid. What is the structure here? Olive. And what is the structure here? Yeah, inferior cerebral peduncle. Right? Is it difficult or easy to understand? Is it clear?
Yes.
Right?
Yes.
Now, what really happens that 6th, 7th and 8th, after that 9, 10 and 11. It's so easy. You know the counting, isn't it? You move from first you move in the sulcus between the pons and medulla, 6, 7 and 8. Then here should be, yes, which nerve? 9th, right? Then what should be there under it? 10th. And what should be here? Cranial part of 11th. Which part? Cranial. And from here, there is which part coming? Spinal part of 11th. 11th, cranial part, and 11th nerve, which is also called accessory nerve, spinal parts. Is that right? And 9th nerve is which one? Glossopharyngeal nerve. And 10th everyone knows, vagus. It's from Las Vegas or from where? What is the meaning of vagus or vagus? It is the word from vagabond or vagabond. What is that? Something lost and going everywhere. Actually, initially when doctors found this nerve, they came to know this starts, it comes out from a sulcus between the olive and inferior cerebellar peduncle, but it is going down, supplying the many structure. It supplies the larynx, pharynx, then it goes down, esophagus, trachea, then vagus supplies the lungs, it supplies the heart, then it supplies stomach, duodenum, jejunum, ileum, liver, pancreas, oh my God, then cecum, ascending colon, and almost half of the transverse colon. So this is really like a vagabond moving from the neck to the thorax to the abdomen, far away, right? So anyway, this is humble beginning of the 10th cranial nerve, right? Is there any problem in understanding this? No. So 6th, 7th, 8th, 9, 10, 11. Is that right? Now come to the frontal view. If we come to the frontal area, yeah, what is it? Yeah. Which nerve is coming? 6, 7, 8, then 9th. What should be here? 10th. And what should be coming here? Cranial part of 11th. And from here, what should be coming here? Spinal part of 11th, cranial part and spinal part. Is that right? Same. You can draw on this side. Which nerve is exiting between this is the sulcus between the olive and inferior cerebellar peduncle. In this sulcus, most superiorly, which nerve is coming? 9th, which is called glossopharyngeal. And which one is this? Vagus. And here is the cranial part of accessory, and here it is spinal part of accessory nerve, right? 11th, but cranial part and spinal part, right? Any question up to here? There's no question. Now which nerve is left? Which one? 12th cranial nerve. So there's no place left, up to now. You see, between the medulla and pons, 6th, 7th, 8th. Then between inferior cerebellar and olive, 9, 10, 11. So this has to come between the pyramid and olive. What is this? 12th cranial nerve, which is called hypoglossal nerve. It comes from multiple rootlets between pyramid and olive. The sulcus between the pyramid and olive, right? And now brainstem is happy because you have understood. Okay, it's showing its teeth also. Right. So look here. This will be the origin of, yes, 12th. Now, in whole this diagram, again, what's the most important thing? You must know that different cranial nerves are attached on the brainstem exactly at which point. That makes you a good doctor. For example, if I say someone has infarction of medulla and 12th nerve is involved, hypoglossi are not working, tongue is not moving. So you know it should be medial lesion or lateral lesion? Medial lesion. But if I say that someone has damage to the medulla and 9th, 10th and 11th nerve is not working well, so what do you think? And if I say there's damage to the brainstem, now listen carefully, damage to the brainstem and 9th, 10th and 11th not working, it is medulla lateral. But if I say there is damage to the brainstem and along with the 9th, 10th and 11th, even 8th nerve is not working, it means damage has extended upward. Is that right? It has extended upward. Is that clear? Any question here? Now let's do a practice. Let's suppose here is the cerebral, this is my brainstem. I've just enlarged it. This is cerebral peduncles of the midbrain. What is it?
Pons.
Yeah, it's pons. And what is it? Medulla again. Now you have to tell me. What is this? Midbrain. Pons is like pregnant woman. Like, listen. What is this? Midbrain. What is it? Pons. And what is this? Medulla. Now you tell me the structure. First I will tell you, later on I will take your test. From the midbrain, from front what is coming out? 3rd cranial nerve. From the midbrain, from the back what is coming? 4th cranial nerve. From pons on the side, 5th. From the pons, 6th, 7th and 8th at the junction of pons and medulla. Now what is this? Medulla. 9th, 10th, 11th, 12th. Is it difficult? Okay, now you have to tell me which nerves are coming out. Right? First you recognize the structures, then we will talk about the nerves. Yes, what is this straight structure? Midbrain. What is this? And what is this? Medulla. What is coming anteriorly? 3rd. 4th cranial nerve. Good. Pons. 5th trigeminal. Then between the sulcus. 6th, 7th, 8th. And then between the lateral sulcus, or your sulcus between the inferior cerebral peduncle and olive. Right? 9th, 10th, 11th. Is that really clear? So now when we will talk about the brainstem, we know exactly cranial nerves are attached where. Later on I will tell you exactly which nuclei are present in which areas. But there's no fun in, there's no difficulty. The 3rd and 4th nerve nucleus should be logically in midbrain. And 5th nerve nuclei must be in the pons. For example, 5th nerve motor. Right? But what is this? Sensory part of the 5th nerve. It is very heavy. So it has a very big nucleus in the pons and one nuclear extension into midbrain, one nuclear extension going to the upper spinal cord even. Its nuclear system goes like this. Right? Principal pontine nucleus of the trigeminal, mesencephalic nucleus and spinal nucleus of trigeminal. Why I am telling you this thing? Because this nucleus you will see in all the sections of medulla, even into pons, even in midbrain lower section. Is that right? So later on, as I have told you these nuclear extensions, I will tell you all the nuclei, exactly how they are placed within the substance of the brainstem. Is that right? Any question related up to this? There's no question? Okay. Now we go another general, you can say, principle related with the brainstem structural architecture.